Hello everyone, I'm Rachel Namiro, a midwife working with Knowledge for Change attached to Fort Portal Regional Referral Hospital.
Hello everyone, I am Joe Odu, a pharmacist working with Knowledge for Change and attached to Fort Portal Regional Referral Hospital.
We shall be discussing sepsis and wound management
in Fort Portal Regional Referral Hospital. What is sepsis? According to the World Health Organization, sepsis is a life-threatening organ dysfunction caused by an abnormal host response to infection. If not recognized early and managed promptly, it can lead to septic shock, multiple organ failure, and death. Sepsis is a serious complication of infection, particularly in low and middle-income countries where it represents a major cause of maternal and neonatal morbidity and mortality. Sepsis frequently results from infections acquired in healthcare settings. These are one of the most frequent adverse effects after a cesarean section. The burden of sepsis in Uganda is difficult to ascertain, although recent data of 2018 from Ministry of Health showed that up to 20 deaths were associated with sepsis in Fort Portal Regional Referral Hospital. Knowledge for Change, through its sepsis management project, reduced this to 1 death in 2021. Healthcare-associated infections are often resistant to antibiotics and can rapidly lead to deteriorating clinical conditions. Antimicrobial resistance is a major factor determining clinical responsiveness to treatment and rapid evolution to sepsis and septic shock. Sepsis patients with resistant pathogens have been found to have a higher risk of hospital mortality. Who is at risk of developing sepsis? Anyone affected by an infection, severe injury, or serious non-communicable disease can progress to sepsis, but vulnerable populations are at a higher risk, and this includes: number 1, old persons, pregnant or recently pregnant women, neonates or young children, hospitalized patients, patients in intensive care units, people with HIV/AIDS, people with liver cirrhosis, people with cancer, people with kidney disease, people with autoimmune disease, and people who have no spleen. What are the signs and symptoms of sepsis? Sepsis is a medical emergency and can present with various signs and symptoms at different times. Warning signs and symptoms include: number 1, fever or low temperature and shivering, altered mental status, difficulty breathing or rapid breathing, increased heart rate, weak pulse or low blood pressure, low urine output, cyanotic or mottled skin, cold extremities, and extreme body pain and discomfort. Suspecting sepsis is a first major step towards early recognition and diagnosis. So what should one do when they suspect sepsis? It's important to note that sepsis is a medical emergency. Thus, it's important to start treatment immediately. Within 1 hour of sepsis being suspected, give: number 1, IV antibiotics. Where there's evidence of a bacterial infection, administer broad-spectrum empirical IV antibiotics before a pathogen is identified. Follow the Fort Portal Regional Referral Hospital antibiogram to determine the most appropriate choice. Number 2, take blood sample or other sample, for example a pulse swab, immediately before antibiotics are started. However, sampling should not delay administration of antibiotics. Now, for those who are not well versed with culture and sensitivity testing, when the sample, it can be blood, urine, sputum, or pus, when the sample reaches the lab, it will be spread on a special growing surface. The grown bacteria is known as a culture, and the bacteria in the culture will grow and multiply. The bacteria will form what we call colonies, or a large group of bacteria that will each be exposed to different antibiotics on a small disc. These colonies can be susceptible, resistant, or intermediate in response to the antibiotics. Susceptible means that they can't grow if the drug is present. This means the antibiotic is effective against the bacteria. Resistant means the bacteria can grow even if the drug is present. This is a sign of an ineffective antibiotic. Intermediate means a higher dose of the antibiotic is needed to prevent growth. Number 3, narrow the choice of antibiotics as soon as a pathogen has been identified and sensitivities are available from the laboratory. If you have difficulties choosing the most appropriate antibiotic, consult a pharmacist to guide you. Number 4, give intravenous fluids. 500 ml of crystalloid with sodium in the range of 130 to 154 millimoles over 15 minutes. If there is any sign of circulatory insufficiency, repeat if clinically indicated, and do not exceed 30 ml per kilogram of body weight. Number 5, give oxygen as needed to maintain the target oxygen saturation between 94% to 96%. Depending on the facilities available, consider continuous monitoring at least every 30 minutes to 1 hour. Monitor oxygen saturation, respiratory rate, heart rate, blood pressure, temperature, hourly fluid balance, including urine output and lactate level. Also take within 1 hour of the risk being recognized. Number 1, like we said above, blood cultures. Number 2, lactate level. It's important to note that a lactate level of more than 2 millimoles per liter is indicative of sepsis. At the moment, this test is not available in Fort Portal Regional Referral Hospital. Number 3, hourly urine output. Now, for post-cesarean section or surgical patients, proper wound management and care is very, very critical. I will now hand you over to my colleague Rachel, who will take you through wound management in Fort Portal Regional Referral Hospital.
There is a designated sepsis room in the gynecology ward with 4 beds specifically designed to non-septic patients with an aim of preventing the spread of infectious microorganisms to other patients on the ward. At Fort Portal Regional Referral Hospital, a patient presenting with sepsis or an infection on the ward can be a referral from another health facility, a readmission from Fort Portal Regional Referral Hospital, or have a nosocomial infection. That means the patient may show up signs of infections before being discharged home. The patient's vital observations should be taken, and any abnormal vitals should be quickly reported to the nurse on duty and a doctor so that the mother is closely monitored. If a patient in postnatal ward is suspected to be having an infection, she should be moved to the isolation room. Daily wound dressing should be done using the correct wound cleaning techniques, sample for count and sensitivity taken, a daily review of the wound by a doctor to note whether the wound is improving or deteriorating. Let me take you through the wound cleaning solutions you should or you shouldn't use in surgical site infection, especially in obstetric and gynecology ward. 1. Normal saline. Normal saline is a preferred cleanser for most wounds because it is physiologic and always be safe. It is an isotonic solution that does not interfere with normal wound repair. It has a low toxicity compared to other wound cleaning solutions, and it doesn't have any allergic reaction. It's a wound cleanser but not a debrider. When used in necrotic wounds, you should dress the wound with honey so as to get quick results. Normal saline should be used in all wounds, whether clean or dirty, but doesn't have antimicrobial properties. When normal saline bottle is open for more than 24 hours, bacterial growth may be present. Number 2, metronidazole. It's not supposed to be used in wound cleaning. It's a wastage since it's given intravenously. Number 3, iodine. Iodine is a cytotoxic agent that can delay wound healing when used for a long time, that is more than 7 days. It is a sensitizer that has advanced effects on the thyroid gland. It causes irritation, dryness, and discoloration. Number 4, hydrogen peroxide. It is now rarely used as a wound cleanser, though it acts as a debriding agent that effectively removes debris and necrotic tissues from the wound surface. In gynecology and postnatal ward, we are reducing the use of hydrogen peroxide since it causes more harm than good. This is because it destroys the normal cells, which are the epithelial cells, thus delaying the healing process of the wound. In case we are to use hydrogen peroxide, it has to be under doctor's instructions and only after assessing the wound, confirming that it has a very thick dead tissue or a black necrotic tissue. When the tissues break down, stop using hydrogen peroxide and switch to normal saline. Number 5, honey. Honey is a viscous fluid. Its jelly consistency creates a surface layer over the wound that inhibits the entrance of bacteria and protects the wound from dehydration. Honey has antioxidant, antibacterial, and anti-inflammatory properties, and this lead to rapid and improved wound healing. Its high sugar content creates a higher osmotic gradient that pulls fluid up through the subcutaneous tissue and offers an additional glucose source for flourishing cellular components in the wound area. The low fluid activity also helps transport oxygen and nutrients from the deep tissue into the wound area, and this quickens the wound healing process. Number 6, Savlon. Savlon is a mixture of cetrimide and chlorhexidine gluconate. Savlon is an antiseptic liquid that kills 99% of germs on the skin. It can be used in theater for cleaning the operating site. We can use it to clean the peri-wound area before wound dressing procedure to prevent the transfer of microorganisms from the surrounding area into the wound. But it should not be used in cleaning the surgical site infected wounds.
As K4C project manager, I would like to thank and acknowledge all team members that have made this project a success. Our team has now extended the work to other wards, including pediatrics and surgical wards. Together, we'll continue to improve wound management and reduce sepsis in Fort Portal Regional Referral Hospital. And thank you for watching.